During the previous 2 lectures, we discussed some important non-communicable diseases. They included essential hypertension, coronary artery disease, diabetes mellitus, in addition to bronchial asthma. Today, we shall discuss epidemiology of some communicable diseases of prime importance in Egypt. They are breast cancer, liver, carcinoma, and lastly, bladder cancer. Firstly, breast cancer. It is the commonest of all female cancers in Egypt. The etiology, as we mentioned before, is not definitely known for all non-communicable diseases, but certain risk factors, precancerous conditions, and the host variables are known to influence susceptibility and incidence of breast cancer. Risk factors for breast cancer. First, hormonal disturbances, including increased estrogen, progesterone, or prolactin. Secondly, contraceptive pills, as studies showed that under certain circumstances, oral contraception may be potentially risky for development of breast cancer. Thirdly, parity, as multipara are exposed to more incidence of breast cancer, especially when regular breastfeeding is not followed. The practice of breastfeeding are exposed to milk retention, with more risk of breast cancer. Also, nulliparous women are more at risk. In addition to delayed childbearing, as women having their first pregnancy after 35 years may show somewhat higher incidence of breast cancer. Fourthly, menstruation, as early menarche before 12 years age and late natural menopause after 50 years are associated with little increased incidence. Fifthly, morbidity, where cancer of one breast increases susceptibility to the involvement of the other. Also, cases of cancer body uterus show more incidence of breast cancer, while cases of breast cancer show increased endometrial cancer. I mean, there is a relationship between the two types of cancer which occur in breast and uterus. Sixthly, family history of breast cancer. Families having vases of breast cancer show higher incidence of the disease, the more intimate the degree of relation, the more the risk is. These are risk factors for breast cancer. As no specific etiology, it is a disease of multifactorial etiology. Host factors regarding breast cancers include either age and or socioeconomic factors. All ages may be affected, but the peak, however, is in the age group 40 up to 50 years. Regarding socioeconomic factors, registered cases may show more incidence in developed than developing countries, and with higher socioeconomic level. This difference may be false and or true. Prevention of breast cancer. Primary prevention cannot be precisely given since etiology is not known. Prevention is based on avoiding exposure to risk factors and the early detection and the management of precancerous lesions or conditions. Firstly, hormonal preparation must be used on medical prescription and only on necessity. Secondly, regular health appraisal, only to diagnose and manage hormonal disorder. Encourage breastfeeding and manage any difficulty. Fourthly, family planning services to help having suitable number of children and avoid multi-parity. Also to help having pregnancies during the favorable childbearing period that elapses between 20 up to 35 years, with optimum pregnancy spacing 3 years. Lastly, to advise attendants for the suitable method of contraception. Control of breast cancer, early case finding and the management through: firstly, awareness of females, especially the high risk for: firstly, performing self-examination of breast, very, very important. Self-examination of breast that can be done by every woman once a month after the menstrual period. Also, avoid taking any drug, especially hormones. Seeking medical care on feeling any breast swelling or mass. Secondly, regular health appraisal for case finding. Great attention should be paid to mammography. Mammography is valuable to screen suspected cases. The second non-communicable disease is liver cancer. Liver cancer may be primary or secondary, but we have to know that secondary cancer is more frequent than the primary one. It is metastatic from the gastrointestinal tract, breast, bronchus, and the other parts elsewhere. Primary liver cancer, one of the commonest cancers in the world. Males are more commonly affected due to being more exposed to risk factors. Forms of primary liver cancer. The first form is hepatocellular carcinoma or hepatoma. This is the commonest form of primary liver cancer. The second is cholangiocarcinoma. The third is adenocarcinoma, having the same clinical picture of hepatoma. Other rare forms include angiosarcoma and hepatoblastoma in children. Etiology and risk factors. A lot of risk factors have been reported. They include B and C viruses of hepatitis, where causal association has been found. Secondly, liver cirrhosis that may arise from B and C hepatitis. Also, alcohol chromatosis may be associated with development of hepatoma. Thirdly, tobacco and cigarette smoking is a risk factor. Fourthly, aflatoxin, naturally occurring chemical metabolites produced by the fungus Aspergillus flavus. Aspergillus flavus may contaminate groundnuts. They are powerful carcinogens of liver. Fifthly, hormonal factors. Regarding the hormonal factor, uncontrolled administration of some hormonal preparation as androgenic steroids may be associated with malignant liver diseases. Sixthly, other carcinogens, nitrosamine, sulfol, and tannic acid, and tannins. Clinical picture: minor and severe clinical manifestation. Minor as fever, weakness, loss of weight, epigastric pain, and liver manifestations including hepatomegaly, jaundice, and ascites. The prognosis is poor and fatal, usually within 6 months. أي أن الخاتمة تكون في خلال 6 أشهر. Diagnosis through alpha-fetoprotein in serum with rising titer. Also through radioisotope or ultrasound scan and liver biopsy. Prevention of hepatoma. Primary prevention is based on prevention of risk factor. Firstly, prevention of viral hepatitis, whether B hepatitis or C1. Regarding B hepatitis, general and specific. Specific through vaccination and seroprophylactic measures. C hepatitis through prevention of exposure to infected blood. No immunization is available yet. Secondly, anti-smoking program. Thirdly, food sanitation with proper storage of nuts, ground nuts, to prevent fungal contamination and growth. Fourthly, education of the public, healthful lifestyle, and avoiding cigarette smoking, alcohol, drug abuse, and the fungus contaminated food. The third non-communicable disease in this lecture is cancer bladder, which plays a major role in Egypt due to the popularity of schistosomiasis. Cancer bladder may be primary, I mean schistosomal or non-schistosomal, or second. Schistosomal cancer bladder is the commonest form of cancer bladder in Egypt. Why? Due to endemicity and repeated exposure to schistosomiasis infection and the negligence of treatment during the last period of time. Predisposing factors for cancer bladder. Firstly, mechanical factor, and secondly, chemical factor. Regarding the mechanical factor, through irritation of the bladder by deposited eggs, besides the secondary bacterial infection may play a role. Secondly, chemical factor, through metabolites produced by adult worms that may be carcinogen. Cancer bladder incidence has significantly declined in Egypt due to available single-dose oral chemotherapy, awareness of the public to avoid the exposure to infection, and finally, widespread health services of primary health care. Prevention of cancer bladder. Primarily through prevention and control of schistosomiasis. While we are discussing this lecture, it is of prime importance to know some important chemical carcinogens. Chemical carcinogens we know include tobacco, first, as including cigarette smoking, showing is also risky. Secondly, hormones, exogenous as synthetic estrogens and androgens cause some endocrine disorder. Thirdly, dietary chemical. We discussed previously aflatoxin, which is produced by certain fungi contaminating food as peanuts, causing liver cancer in addition to alcohol. Fourthly, air pollutants through traffic and industry. Traffic, including exhaust products of fuel combustion. Industry, exposure to asbestosis and نيكل في صناعة الأسبستوسز والنيكل. Others as asphalt, tar, soot, the exposure of chimney, المداخن sweeps, المسحة بتاعت المداخن to cancer scrot. Thanks.